Welcome to today's video about early signs of psoriasis. Have you ever noticed patches of scaly, itchy skin that just won't respond to moisturizer no matter how much you apply? What if I told you that what you're dismissing as stubborn, dry skin could actually be an early sign of psoriasis, a chronic autoimmune condition affecting over 125 million people worldwide? Today, we're diving deep into the subtle world of early psoriasis detection. We'll uncover 11 warning signs that are commonly mistaken for ordinary dry skin, but could actually indicate something much more significant happening beneath the surface. By the end of this video, you'll have the knowledge to recognize these crucial differences, information that could potentially transform how you approach your skin health. Stay with me, because sign number 7 about nail changes will completely revolutionize how you look at your fingernails and toenails.
All right, here comes the list of early psoriasis signs. Let's begin with number 1, well-demarcated raised plaques. Let's start with one of the most telling yet commonly overlooked early signs. Picture examining what you think is just another patch of dry skin, but instead of typical, irregular, fading edges, you notice something distinctly different. The affected area has sharp, clearly defined borders that create an obvious boundary between normal skin and the problematic patch. According to Mayo Clinic and Cleveland Clinic research, psoriasis creates what dermatologists call well-demarcated plaques. These aren't simply flat, dry areas, they're slightly elevated patches with remarkably precise edges. The raised nature indicates increased cellular activity beneath the surface. Unlike regular dry skin that gradually blends into normal skin with soft borders, psoriatic plaques announce themselves with distinct, almost geometric boundaries. This occurs because psoriasis causes your immune system to work overtime, accelerating skin cell production and causing cells to pile up, creating these characteristic elevated lesions. Next, sign number 2, silvery-white scale. Now we're entering territory that often sends people down the wrong diagnostic path. You've probably seen normal skin flaking, those light, thin pieces that brush away easily when your skin gets dry. What we're discussing here is entirely different and much more significant. Research from Mayo Clinic, Cleveland Clinic, and American Academy of Dermatology describes a distinctive characteristic of psoriatic lesions: thick, silvery white scaling with an almost metallic appearance. This scaling is substantially thicker and more adherent to the underlying skin than ordinary flaking. The silvery appearance is particularly diagnostic. Regular dry skin produces flakes that are typically white or clear, but psoriatic scales have this distinctive metallic quality that catches and reflects light differently. This occurs because rapidly multiplying skin cells stack up and create layers that reflect light through the scale structure. These scales don't brush away easily like normal dry skin flakes. Instead, they cling stubbornly to the surface, requiring more effort to remove and often come off in larger pieces. The thickness and adherent nature reflect the underlying inflammatory process driving rapid skin cell turnover, a fundamental characteristic of psoriatic disease. Next, sign number 3, bleeding when scale is removed. Here's something that might sound concerning, but is actually one of the most specific indicators that you're dealing with psoriasis rather than ordinary dry skin. There's a clinical phenomenon called Auspitz's sign that can help distinguish psoriasis from other skin conditions. Research published in medical journals, including studies in PubMed and documented by the American Academy of Dermatology, describes this phenomenon. When you gently remove the silvery scales we just discussed, tiny pinpoint spots of bleeding appear underneath. While this finding isn't 100% specific to psoriasis, it's rarely seen with simple dry skin. However, it's important to note that research published in PubMed by Pearson and colleagues found that Auspitz's sign was present in only about 17% of psoriasis patients studied, indicating it's not always present. The absence of the sign doesn't rule out psoriasis, but its presence can be a valuable diagnostic clue. This bleeding occurs because psoriatic inflammation affects the small blood vessels just beneath the skin surface, making them more fragile and closer to the surface. When the thick, adherent scales are removed, these delicate vessels become exposed and may bleed slightly. The key distinction is that regular dry skin might cause minor irritation if scratched vigorously, but the characteristic pinpoint bleeding pattern after gentle scale removal is distinctly different and suggests active inflammation occurring beneath what might otherwise appear to be harmless dry skin.
Next, sign number 4, deep cracking and bleeding. Moving beyond surface changes, let's discuss a pattern of skin damage that frequently gets misattributed to severe environmental dryness. Research from Mayo Clinic and Cleveland Clinic documents that psoriatic lesions can develop deep fissures that actually bleed, particularly over areas where skin experiences regular movement and stretching. Unlike superficial cracking you might see with very dry skin, psoriatic lesions develop deep cracks that often occur over joints like knuckles, elbows, and knees. The mechanism is both fascinating and problematic. Psoriasis causes skin to thicken significantly due to rapid cell turnover, making it less flexible and more prone to splitting during normal movement. Additionally, the inflammatory process affects the skin's natural barrier function, reducing its ability to retain moisture and maintain normal elasticity. Even with aggressive moisturizing, these fissures tend to persist or recur because they're driven by the underlying inflammatory process rather than simple moisture loss. The bleeding associated with these cracks isn't just from mechanical trauma. It reflects the fact that the inflammatory process has made the skin more fragile and the underlying blood vessels more prone to rupture. This creates a concerning cycle where cracking leads to further irritation, which can trigger more psoriatic activity in the affected area. This type of persistent, deep cracking that doesn't respond well to standard moisturizing approaches should raise suspicion that something more than environmental dryness might be occurring. Next, sign number 5, intense itching, burning, or soreness. Now we're exploring symptoms that really separate psoriatic involvement from ordinary dry skin. And this is often where people begin to realize something more significant might be happening. The sensory symptoms of psoriasis are distinctly different and more intense than what you'd experience with simple dryness. Research from NCBI, Mayo Clinic, and Cleveland Clinic documents that psoriatic lesions often cause intense itching that goes far beyond typical dry skin irritation. Many patients describe sensations including burning, stinging, and soreness that can be quite uncomfortable and persistent. The intensity and persistence of these symptoms are particularly telling. While dry skin might cause occasional itching relieved by moisturizing, psoriatic discomfort tends to be more constant and less responsive to simple interventions. The burning and stinging sensations occur because the inflammatory mediators in psoriatic lesions irritate nerve endings in ways that simple dryness cannot. Many patients report that this discomfort interferes with sleep, concentration, and daily activities in ways that ordinary dry skin rarely does. The soreness component is particularly characteristic, representing the inflammatory process affecting deeper skin layers.
Next, sign number 6, small scaly spots in early stages. This sign is particularly crucial for early detection, especially in younger individuals. Before psoriasis develops into the larger, more obvious plaques that most people recognize, it often begins much more subtly with presentations that can easily be dismissed. Mayo Clinic research documents that early-stage psoriasis, particularly in children and adolescents, frequently presents as small, discrete, scaly spots rather than large patches. These spots, sometimes called guttate lesions, are typically teardrop-shaped and much smaller than classic psoriatic plaques that develop later. These small lesions can appear scattered across the body, often following infections like strep throat. They're frequently seen on the arms, legs, and trunk, areas where people might expect some seasonal dryness. The scaling on these small spots might be minimal initially, making them even easier to overlook or misattribute to minor skin irritation. The key differentiating factor is persistence and potential progression. While ordinary small dry spots tend to resolve with basic skincare, these early psoriatic lesions persist and may gradually increase in size or number over time. Some may eventually merge together into larger plaques, revealing their true nature. Early recognition of this pattern is crucial because it represents a window of opportunity for intervention that might help prevent progression to more extensive disease. Parents might notice these spots on their children and assume they're related to weather changes or minor skin irritation, when they actually represent early psoriatic involvement. Next, sign number 7, nail changes. Here's the sign I mentioned would revolutionize how you look at your nails, and it's often completely overlooked because people don't associate nail problems with skin conditions. This is actually one of the most specific early indicators of psoriatic disease and can appear even before obvious skin lesions develop. Extensive research from NCBI, Cleveland Clinic, and American Academy of Dermatology documents that nail psoriasis affects an estimated 40 to 50% of patients with psoriasis. The changes include several distinctive features: pitting, tiny holes or dents appearing randomly across the nail surface, discoloration ranging from yellow to brown, thickening of the nail plate, and separation of the nail from the nail bed called onycholysis. Cleveland Clinic notes that pitting can range from tiny pinpoint depressions to larger dents, and patients may have just 1 or 2 pits per nail or more than 10. Oil drop or salmon patch discoloration appears as translucent yellow-red spots beneath the nail plate, and is considered one of the most diagnostic signs of nail psoriasis. What makes this particularly important for early detection is that nail changes can precede obvious skin symptoms by months or even years. Someone might notice small pits or yellow-brown discoloration and attribute it to trauma, fungal infection, or normal aging, when it's actually an early manifestation of psoriatic disease.
Next, sign number 8, symmetrical distribution. This pattern recognition sign is something dermatologists rely heavily on for diagnosis, and it's an observation you can make yourself. Research from Cleveland Clinic, the American Academy of Dermatology, and other major medical institutions emphasizes that psoriasis has a strong tendency towards symmetrical presentation. What this means is that if you develop a psoriatic lesion on your right elbow, you're very likely to develop a similar lesion on your left elbow. The same pattern holds true for knees, hands, and other paired body parts. This symmetry is so characteristic that its absence might actually argue against a psoriatic diagnosis. The biological reason behind the symmetry relates to the systemic nature of psoriasis. Unlike localized skin conditions caused by external irritants or contact issues, psoriasis is driven by internal immune system activity that affects the body systematically. The immune system doesn't favor one side of the body over the other, so the inflammatory response tends to manifest symmetrically. Common locations where the symmetrical pattern appears include the elbows, knees, scalp, and lower back. The American Academy of Dermatology notes that persistent dryness in these typical psoriatic locations should be taken more seriously, especially when it appears symmetrically. Regular dry skin, by contrast, tends to be more random in its distribution. Environmental factors like sun exposure, contact with irritants, or localized trauma typically don't affect both sides of the body equally, so asymmetrical patterns are more common with simple environmental dryness. This symmetrical pattern is particularly valuable for early detection because it can help distinguish between psoriatic involvement and other skin conditions, even when individual lesions are small or cause minimal symptoms. Next, sign number 9, smooth red patches in skin folds. Here's where psoriasis really demonstrates its deceptive nature and why so many cases initially get misdiagnosed. The American Academy of Dermatology documents a specific subtype called inverse psoriasis that affects skin folds and behaves quite differently from the classic presentation most people associate with the condition. In areas like the groin, underarms, under the breasts, and other skin fold regions, psoriasis presents as smooth, red patches that often lack the characteristic thick scaling we discussed earlier. Because these areas are naturally moist, the typical silvery scales don't develop, making the condition look remarkably similar to chafing, fungal infections, or simple irritation. This presentation is particularly challenging for diagnosis because these locations are where people commonly experience skin issues from friction, moisture, and heat. It's easy to dismiss redness in the groin area as chafing from tight clothing or irritation under the arms as a reaction to deodorant or antiperspirant. The American Academy of Dermatology specifically notes that the moist environment in skin folds prevents formation of the typical psoriatic scale, which is often the most recognizable feature of the condition. Without this classic sign, the smooth red patches can be easily misattributed to other common causes. What makes this particularly important is that inverse psoriasis can be quite uncomfortable due to the friction and moisture in these areas, and it often doesn't respond to treatments that would work for simple chafing or fungal infections. The persistence of symptoms despite appropriate treatment for other conditions can be a valuable clue that something else is occurring.
Next, sign number 10, trigger-driven flare-ups. This behavioral pattern of symptoms is one of the most telling indicators that you're dealing with the psoriasis rather than simple dry skin. Understanding these triggers can be crucial for both diagnosis and future management of the condition. Research from Mayo Clinic and Cleveland Clinic extensively documents that psoriasis often flares in response to specific triggers that wouldn't typically worsen ordinary dry skin. These include physical injury to the skin, known as the Koebner phenomenon, where new psoriatic lesions develop at sites of trauma, like cuts, scratches, or pressure from tight clothing. Infections, particularly strep throat, can trigger widespread flares, especially in children and young adults. Stress is another major trigger that can cause existing lesions to worsen or new ones to appear. Certain medications, including some blood pressure medications, lithium, and anti-malarial drugs, can also trigger flares. Climate changes, particularly transitions to drier weather, can worsen psoriasis, but the pattern differs from ordinary dry skin. While dry skin typically worsens gradually with environmental changes, psoriatic flares can be more abrupt and dramatic, often involving new lesions in previously unaffected areas. Next, sign number 11, persistence despite proper moisturization. This final sign is perhaps the most practical and immediately recognizable red flag that something more than ordinary dry skin is occurring. This persistence is often what finally drives people to seek dermatological evaluation. Think about it logically. If you genuinely have dry skin, consistent use of quality moisturizers, gentle cleansing, and avoiding harsh environmental conditions should lead to noticeable improvement within a few weeks. However, true psoriatic lesions show minimal or no improvement with standard dry skin care approaches. Cleveland Clinic research specifically documents that psoriatic lesions may continue to thicken, develop more scaling, or even expand despite aggressive moisturizing regimens that would completely resolve ordinary dryness. This persistence occurs because the underlying problem isn't moisture loss. It's an immune-mediated inflammatory process driving rapid skin cell turnover. The non-response to moisturizers is particularly frustrating for patients who are doing everything right for dry skin care, but seeing no meaningful improvement. This often leads to a cycle of trying increasingly heavy moisturizers or applying them more frequently, which may provide temporary comfort, but doesn't address the underlying inflammatory process. This sign is valuable because it's something most people can assess themselves over time. If areas of what appear to be dry skin don't respond to several weeks of consistent, appropriate skincare, it's worth considering that the problem might be something other than simple environmental dryness. The combination of persistence and non-response to appropriate treatment is often what finally prompts people to seek professional dermatological evaluation, leading to proper diagnosis and treatment.
These 11 early signs represent crucial warning signals that your body might be sending about the presence of psoriasis rather than simple dry skin. The key takeaway is that psoriasis is often a master of disguise, presenting with subtle symptoms that can easily be dismissed or misattributed for months or even years. Early recognition and proper diagnosis are essential because psoriasis isn't just a cosmetic concern. It's a systemic inflammatory condition that can affect joints, cardiovascular health, and overall quality of life if left untreated. The encouraging news is that when diagnosed early, highly effective treatments are available that can help control symptoms and prevent progression to more serious complications. If you've recognized multiple signs from today's discussion in your own symptoms, don't panic, but do consider scheduling an evaluation with a dermatologist. Professional assessment can provide clarity, and if psoriasis is confirmed, open the door to appropriate treatment options that can significantly improve your skin health and overall well-being. Remember, knowledge about your body is one of the most powerful tools you have for maintaining your health. Early detection and proper treatment can make an enormous difference in managing psoriatic disease effectively. If this video was helpful, kindly type "helpful" in the comment section. That motivates us to produce more evidence-based content like this. Don't forget to give this video a thumbs up if it provided valuable information, share it with anyone who might benefit from understanding these important health distinctions, and subscribe to our channel for more reliable health content. Thank you for taking the time to learn about these crucial health indicators.